Hypolipidemic drugs. Hypolipidemic drugs are those drugs which lowers the level of lipids and lipoproteins in the blood. So our main objective is to know the mechanism of action of different hypolipidemic drugs. Classifications of hypolipidemic drugs. HMG-CoA reductase inhibitors, atorvastatin, pravastatin, rosuvastatin, simvastatin. Bile acid binding resins, cholestyramine, cholestypol, cholesevelam, cholesterol absorption inhibitor, ezetimibe, fibric acid derivatives, fenofibrate, gemfibrozil, lipolysis and triglyceride synthesis inhibitor, niacin, that is vitamin B3, nicotinic acids. Other drugs are lomitapide, gugulipid, omega-3 fatty acids. Now let's talk about sites and mechanism of drugs for hyperlipidemia. Ezetimibe inhibits the absorption of dietary and biliary cholesterol from the intestine. So ezetimibe inhibits the absorption of cholesterol from intestine. The HMG-CoA reductase inhibitors blocks the rate limiting step in cholesterol synthesis. The bile acid resins inhibits the absorption of bile acid from the gut. Niacin inhibits the secretion of VLDL from the liver. And fibrates such as gemfibrozil stimulates the lipoprotein lipase to increase the hydrolysis of VLDL and so delivery of fatty acid to adipose and other tissue is increased. HMG-CoA reductase inhibitors. It is most effective and best tolerated agents for treating dyslipidemia. Statins competitively inhibits HMG-CoA reductase, so there is decreased synthesis of cholesterol. HMG-CoA reductase enzymes more active or its activity is maximum in night time, so nighttime dose is mostly preferred. There are compensatory changes due to decreased synthesis of cholesterol, that is increased expression of LDL receptor on surface of liver cell. So there is more uptake of LDL from plasma, hence there is decrease in plasma LDL. Other changes are decreased VLDL synthesis. Bile acid binding resins. Bile acid binding resins with bile acids form insoluble complex in intestine. It is excreted in feces, which indirectly leads to increased hepatic conversion of cholesterol to bile acid. So why there is conversion of cholesterol to bile acid? Due to more utilization of bile acid to form this insoluble complex. So there is more conversion of cholesterol to bile acid to maintain the normal concentration of bile acids in body. So due to this conversion, there is decreased intracellular concentration of cholesterol. And also to maintain bile acids to normal level, there is increased hepatic uptake of cholesterol containing LDL particles. So this overall mechanism leads to fall in plasma LDL and increased clearance of plasma LDL, IDL and indirectly VLDL. Lipolysis and triglyceride synthesis inhibitor. Niacin or nicotinic acid binds to niacin receptor, that is G protein couple receptor, results in decreased activity of hormone sensitive lipase, which decrease the influx of free fatty acids from adipose tissue to liver. So there is decreased synthesis of triglycerides in the liver. Triglyceride is the constituents of VLDL. So there is decreased plasma VLDL and LDL is formed from VLDL. So there is decreased plasma VLDL. Due to less plasma VLDL, there is less cholesterol delivery in peripheral cells or tissue. Niacin also increase plasma half-life of apolipoprotein A1 and also decrease ApoA1 clearance. So there is increased plasma HDL which support reverse cholesterol transport, and so there is increased cholesterol delivery from HDL to liver. So this is how niacin works. Fibric acid derivatives. Fibrates activate PPAR alpha, that is peroxisome proliferator activator receptor alpha. It is present in liver, adipose tissue and skeletal muscles. So when there is activation of PPAR alpha, there is increase in HDL levels. There is increase in lipoprotein lipase synthesis and its activity. So when there is increase in lipoprotein lipase synthesis and activity, there is increase in clearance of VLDL, and so there is decrease in plasma triglyceride levels. It also increase LDL receptors in the liver, and so there is increase in LDL uptake and its degradation. It also increase fatty acid oxidation, so there is decrease in triglyceride levels. So this is how fibric acid derivatives work. Lomitapide, it inhibits MTTP. MTTP means microsomal triglyceride transfer protein. So lomitapide reduces the production and release of VLDL and LDL levels in plasma.